Congratulations on being pregnant. And I bet you're not that concerned about your belly because you know it's just going to get bigger as the baby grows, right? But I'm here to tell you that you do want to be concerned about your belly and you want to protect this so that you can avoid developing a condition called diastasis recti, where your abdominal muscles separate. And there's three things that you can do that can avoid this diastasis from happening in your body. And if you stay tuned, I'm going to share those three things so that you have less healing to do after having your baby. Hi, my name is Lynn Schulte. I'm a women's health physical therapist at Intuitive Hands Physical Therapy in Denver and Boulder, Colorado, and I am your birth recovery expert. And today we're going to be talking about 3 ways to avoid having diastasis recti. So let me just share with you. This is diastasis recti. This is your normal rectus abdominis muscles, and then this is what that separation is. And the more this separates, the more healing you have to do after having your baby. So let's try to avoid it in the first place. The first thing we want to do is we want to make sure that we're not a rib thruster. Okay, when we were younger, our mamas told us to stand up straight. Well, in standing up straight, we've actually thrusting our ribs forward to make that happen versus just bringing our shoulders back. So the first thing you want to make sure is that your ribs are in line with your hip bones here and that they're not jutting in front of your hip bones. This is rib thrusting. This is not. When we have these 2 points in the same plane, we're not thrusting our ribs. When we're thrusting our ribs, it actually increases pressure and causes more separation of our abdominal muscles. So really just tucking your ribs, making sure that your ribs dump into your pelvis here and not in front of it. So that's the first step, is avoid rib thrusting. The second step is to make sure you get up and down from laying down the correct way to avoid any doming or straining on your abdominal muscles. And the best way to do that is to sit on the edge of your bed, engage your abdominal muscles, pull your belly button back to your spine, and come down onto your side here, and then put your head down. Your head is the most important piece here. Once your head goes down, then you can roll over onto your back. But a lot of people want to keep their head up and roll over, and that can really strain the abdominal muscles. So keep your head down and roll over onto your back. Then to get up, avoid leading with your head. This is the most common natural response to sitting up, is to lead with your head. But if you can keep your head down and engage your belly, roll over onto your side and engage your belly as you go to sit up, make it a 2-step process and you will protect your abdominal muscles and avoid that separation. And along with this, the third step is to avoid any type of doming in the midline while you're pregnant. That doming can cause greater separation of the abdominal muscles, and we want to try to keep them together. So I know it might look like a cool party trick, but it's really not doing your body or your abdominal muscles any favor by allowing that doming to happen. So if you notice that your belly's doming, stop what you're doing, engage your abdominal muscles, pull your belly button back to your spine, and then do the activity. If you can't avoid the doming, you shouldn't be doing the activity. So by pulling in the belly button, you should be able to minimize or avoid that doming from happening in the first place. And that can help keep your muscles together and allow less separation to occur during your pregnancy. So engage the transverse abdominis muscle, work those muscles, make sure that your abdomen stays strong during your pregnancy and you don't just let it get weak and loose from carrying that baby. Really engage those muscles and keep them as strong as you can during pregnancy, and avoid having that separation from happening in the first place so that you have less work to do, less healing to do after you have your baby. And all 3 of these points apply after you have your baby. Keep watching your rib thrusting, watch the way you get up and down from laying down, and avoid any doming after having your baby. The body wants to heal, it wants to come back together, and if you can keep doing these 3 things, then you will allow your body to heal and let those muscles come back together, okay? Good luck, everybody. Take care.